Hey, what's up, you guys? Thanks for coming back and listening to my snazzy presentation, my very basic presentation in the midnight hour, coming to you from Tokyo, the very quiet podcast because the people above me are sleeping. That's why I'm talking in this tiny voice. So,
come on, don't bullshit me.
Let's get to it. We're going to be talking about Guillain-Barre Syndrome and Charcot-Marie-Tooth Disease. And this is a very, very quick summary. Don't take this as a full summary. It's from medbullets.com. It's just for a quick reminder before you take a test. Some things to think about. So here's the snapshot first for Guillain-Barre Syndrome. A 32-year-old man presents to the ER with worsening lower extremity weakness. The patient was in his usual state of health until approximately 1 week prior to presentation, where he developed increased difficulty climbing the stairs. Now he is unable to stand. A few weeks ago, he developed bloody diarrhea, which he attributes to drinking unpasteurized milk. On physical examination, he has bilateral lower extremity, 1 of 5 strength with absent patellar reflexes. That's Guillain-Barre Syndrome. So what about Guillain-Barre? Let's have an introduction. It is an acute, inflammatory, demyelinating polyradiculopathy, AIDP. Most common presentation. Inflammatory demyelination of peripheral nerves. Autoimmune attack of peripheral Schwann cells due to molecular mimicry. Previously, this is a buzzword you might see. Remember Campylobacter jejuni and Mycoplasma pneumoniae may have an association with Zika virus infection. How does it present? Symptoms. Symmetric weakness usually begins in the distal limbs and moves proximally. Can begin proximally or a combination of proximally and distally. Physical exam. Decreased or absent deep tendon reflexes. Cranial nerve involvement, common, resulting in facial paralysis. Autonomic dysfunction resulting in cardiac irregularities and fluctuations in blood pressure. Evaluation for Guillain-Barre Syndrome. LP, in there you would see, for the LP you'd see albuminocytologic dissociation. You'd see an increase in CSF protein with normal cell count. And for the treatment, almost all patients survive and achieve complete recovery in several weeks. Respiratory support is critical until recovery. So remember that about pulmonary function testing is very important with Guillain-Barre Syndrome. Plasmapheresis or IV immunoglobulin, equal efficacy, no additive benefit. As for prognosis, prevention, and complications, the prognosis, low mortality, complications, respiratory failure. Remember, respiratory failure with Guillain-Barre. Moving on down, we're going to look at Charcot-Marie-Tooth Disease. Just a few bullet points here. It's also known as hereditary motor and sensory neuropathy, or HMSN. It is a group of disorders negatively affecting peripheral nerves and or myelin, genetically distinct disorders. How does it present? What are the symptoms? Peroneal nerve neuropathy, lower leg atrophy. Remember the inverted bottle appearance. There would be diminished or absent reflexes and a decrease in vibration and proprioception sense. You might see pes cavus. And the treatment here is unfortunately supportive. There we have it. Thanks for listening there for a short discussion of Guillain-Barre Syndrome and Charcot-Marie-Tooth Disease. This is Med School Radio.